All right, well, just to make sure, we have to clap once more because that was really a tremendous group of 5 speakers. So for everybody. All right, I think we're doing well with the schedule. We have 3 expert consultants. I see 2 of them. I'm hoping that David Riley is here. Great. Would you mind coming up and sitting up in the front? Oh, and this is my way of showing that I really am me. Okay, great. Okay, so how about if the 3 of you stand up and I will say who each of you are, and then we'll have you come up. So we have Steve Yaffe, who's the Transit Services Manager of Arlington County. David Riley is the Veterans Transportation Program Director, Department of Veterans Affairs. And Peter McNichol is the Chief of Quality Control, Non-Emergency Medical Transportation Department of Vermont Health Access. We'll see if he's feeling the burn. So we'll start with Steve.
Great presentations. I want to take this opportunity to anticipate our last assignment of the day as to how we can put all this together. One particular concern I've had over the years is the predictive models used to anticipate future ADA paratransit ridership seems to be overly based on overall census figures and not enough on market segmentation. And I think there's a need to do market segmentation, not only to provide a more accurate predictor of need for paratransit, but also to predict, correspond on the health side. Who's going to need rides to get treatments? I really enjoyed some of these presentations, and we'll be talking to some of you at more length about it. But there's a lot of data, some of which we heard about today, both from the aging side, the IDDS side. I talked yesterday about USRDS being a fantastic database. I'm jealous of some of the data on the health side particularly. And we can predict transportation need by source, renal failure, for example. On the IDDS side, we have people who are surviving with severe intellectual disabilities. There are also people surviving with severe physical disabilities that arise from birth, aging through the school system, graduating at 21 in Maryland or 22 in Virginia, and then needing day support and other support programs and transportation to those programs. Heard of a statistic last week from the Eye Institute about the incidence of blindness and low vision arising, doubling over the next few decades. And my question is, how can we do market segmentation with the databases that you have, some of you using census block data, to more accurately predict demand both where and why? And I think that's sort of a general question that you may want to react to, and then we may want to talk about more of that later. Thank you.
Go ahead.
I think that when we talk about demand, we also have to talk about supply. And the availability of transit resources in some counties, in some communities, is so limited that we have to look at how we can potentially improve transit infrastructure. We are a car-owning country. We're an automobile vehicle-owning country. We neglect public transportation. There are odd, again, as you all probably gathered, I'm a native New Yorker, so public transit is a genetic condition with me. But there's a stigma about using public transit. It came out in some of the qualitative data that we've gathered that Dennis Johnson spoke about briefly yesterday. We really need to improve public transit availability and usability. And so, I get concerned, like there's a federally funded program out there that's looking at some very comprehensive screening for need for enabling services to get to healthcare. and one of the things that's being screened for is transportation, but there's a prohibition against using any of the funding to increase the availability of transportation. So I just want to add that caveat that we need to look at what the needs are and predict where the needs are, but we really need to strengthen infrastructure to meet those needs. And that probably, since I know we have a lot of people from federal government in the House, it may require some looking at how monetary resources, funding are allocated.
Okay. Well, certainly using something like the tools we have on Community Commons or a geographic information system in general, you can sort through a variety of data sources. In this case, you might use the American Community Survey to help you identify subpopulations that you might want to target, and then show that information in relationship to transportation nodes or something like that, availability of transportation, and start to look for those comparisons within that data. You might also use the geographic information system to carry that a little bit further and find out whose congressional district that's in and move forward from there.
Good morning. So just a few words about myself and the VA. We will have opportunity to talk more about that because I'm on the next panel, so you'll hear all about our stuff. But I wanted to just comment, it's been 6 years since the VA really started to enter the world of transportation. Back when our program, Veterans Transportation Service, was created, we reached out to United We Ride and others in the transportation community. Doug Burney really was a big influence on us, for those of you who remember Doug. And we have borrowed liberally from what we've learned through the transportation community. So that's part of the reason I'm here today, is to continue that conversation and to learn as much as I can. So forgive me if I'm a little behind. It's only been 6 years, right? We are very interested in the VA, of course, in veterans. So these marvelous surveys, it sounds like they, to some degree, can be broken down into subpopulations. So that's very useful to know. One of the problems we run into is, as we try to demonstrate the business side of transportation, show that to VA leadership that transportation is a good business decision in terms of getting veterans to care, getting people to care when they need it, and prevention. As we try to do that, we're faced with the question of how can you demonstrate that this person would not have gotten to care without your service? And that's a tough one. So anybody that has any ideas about that, we can certainly use the conversation. And I think that's going to happen with the entire transportation community, because as you think about a good metric to defend transportation, that's what we call missed opportunities in the VA, or no-shows, pretty much. So when patients do not make it to their appointment, there may be clinical resources that are already dedicated to that appointment that could go to waste. So if we can show that we are making good use of those clinical resources, that we're reducing the time that's lost by the clinicians, then we have a good case for showing that transportation is, in fact, a good business decision. How can that be done? We can use surveys, perhaps, to have the patient say, I would not have otherwise made it to my health care. And that's what we're trying to do in the VA right now. It's difficult. But there must be another way, and if there is, I need to hear about it, that we can demonstrate that, in fact, this was the solution to that particular no-show. This was it. Transportation made the difference between this individual perhaps languishing with a chronic medical need or making it to their appointment and continuing to make their appointments so that their medical conditions improve instead of get worse. That's a tough one. And also specifically, as we talk about metrics in transportation, we need to identify those areas of cost, just like a missed opportunity is cost. Another example would be somebody going into a nursing home. If they don't have sufficient transportation to live independently, what happens? They have to go to a higher level of care. It's those steps, and I think it was referred to yesterday as enabling services. You know, those services that allow people to remain in their home and be independent as opposed to going to a higher level of care, which of course is very, very expensive. So any thoughts on those topics or how the surveys could possibly be tailored to address issues like that?
I'll take a crack at that. So one of the things that Bureau of Transportation Statistics has been doing is looking at matching across administrative data. And recently we have started using data from USDA, where they have attempted to measure the quote-unquote food deserts. And what we're doing is we're matching the transportation accessibility within those food deserts to both better understand people's nutrition. How are people eating if they are in an area that is not well served by a grocery store with fresh fruits and vegetables? They are tracking, they have data on exactly what people are buying and how they are getting to their grocery stores. And so that's how we're using a measure of accessibility at the census tract level to say, not necessarily that person, we're not going at the individual level to say that person X didn't eat a healthy diet and here's why. We're saying that within this census tract, here are the challenges to their transportation, here are the challenges to how far and how long they have to travel to get to a more food accessible community. And we've talked about doing the same, looking at availability of Tier 1, Tier 2, Tier 3 healthcare. Again, that data exists at the census tract level. We have, at the census tract level, we soon will have, within the next year, we're developing out the regular route bus systems, but we have it for all the fixed systems. We know some areas that are even accessible by car actually have other challenges because of parking issues and other transportation issues that we're also trying to bring into this. But that's where we hope to be, and the model that we have in our workshop to try to measure this difficult term called accessibility.
Yeah. I'd like to make a suggestion with regard to looking at data across agencies, across different sectors, and that is that we come up with some standardized definitions. I'm sure I'm not the only person in the room that has been horrified by the number of different definitions of rural. It's just extraordinary. You ask a simple question, is this a rural county? I could give you 5 different answers, and they're not all the same. Uninsured, the arbitrary definitions, the different federal household surveys use different standards to determine whether or not a person is uninsured continuously within 12 months. Has there been a break in continuity of coverage? So you ask a simple question like, what's the uninsured rate? And you can come up with multiple different answers. I mean, even in a stable place like New York, well, maybe New York City isn't a stable place, but a place like New York City, you can't even define what a community is, because you have community districts, you have census tract districts, you have health districts. The health department has its own sense of what a community is that corresponds to nothing else. So it makes it very, very difficult for people that are trying to get straight answers to simple questions to do so. So I think that if we're going to take a serious look at improving availability of data for planning purposes, or again, HIPSA, There's health professional shortages, there's medically underserved areas, there's medically underserved populations. There was a request for comments, do we need the 3 different designations? I think everybody that answered said no, there's been no change on that. So again, a lot of this is at the federal agency level where, agencies just look at the same thing differently. Having some standardization on that would be enormously helpful.